Hi, I'll talk about what I've learned about anxiety disorders, which being my project topic. Anxiety disorders are a type of psychological disorders. Anxiety is defined as various disorders that cause irritability, fear, and anxiety. This can affect daily life when it's severe and it's necessary to treat it. There are types of anxiety such as panic disorder, obsessive compulsive disorder. In general, the treatment method of all types is similar. Medicine treatment and behavioral therapy method are used. In behavioral therapy method, the method of focusing anxious situations with the support of a therapist is applied. I wrote my essay on obsessive compulsive disorder. I learned that OCD is constantly repeated thoughts and repeated behaviors called obsessions. Although OCD patients knows that his anxiety stir thoughts don't make sense, but he can't feel good without making his comforting behaviors. For example, if a mother doesn't kiss her child 3 times when she sends her child to school, she thinks something's going to happen to her child, but she doesn't believe it exactly. The causes of OCD's emergence are divided biologically and environmentally. From biological points of view, in the case of OCD, there is excessive activity in certain parts of the brain. When symptoms occur, the brain becomes more active. In environmental factors, stress is at the forefront. Harassment, problems, losses, relationship concerns are also environmental factors. OCD shows itself in many ways. There are a few of these situations where they fear pollution, obsession with order and symmetry, counting things, repeating words all the time. It is imperative that these obsessions, which are as physically tired as they are mentally, should be treated. Now, I'll show you a video of an expert talking about OCD on children.
It can be obsessive thoughts and repetitive behaviors. Children with obsessive compulsive disorder can be diagnosed as young as 6 years old.
OCD is a disorder that is comprised of obsessions and compulsions. It's probably about 2% of the population in children, and that may be an underestimate because people don't always like to talk about it.
Child psychiatrist Dr. Denise Duchik says the obsessions can interfere with the child's concentration.
When it starts interfering with their ability to engage in their usual activities, school, going out to play, engaging in family activities, because they have to do their compulsive behaviors and repetitive rituals, then that's probably the time to bring them in.
OCD is a hereditary disorder that can often link to other problems like ADHD, Tourette's, even depression.
Some of the compulsive behaviors might be the need for symmetry, having things just lined up just so, or in an even fashion.
The disorder can be lifelong, but with treatment, some children can outgrow it.
Yes, it can be treated quite well. We have psychotherapies that will be helpful. Sometimes the cognitive behavioral psychotherapy will help.
Doctors may also recommend medication. If a child starts a treatment, it's important the treatment is consistent at home and at school. For Lee Health, I'm Lindsay Fry.
Psychological disorder experienced in childhood can affect the entire life of the individual, so parents shouldn't see these kinds of problems temporarily. Now I want to talk about panic disorder. Panic attacks are intense distress or fear seizures that occur suddenly and occasionally recur. It can leave patients in dismay. Doctors say panic attack, what patients call crisis, Chest pain, chest compression, shortness of breath, fear of death, such as symptoms. Biologically, some hormones in our brain are the results of abnormal study. As I said before, this disorder is used in medicine treatment and behavioral therapy. The best results are obtained by the combination of these two treatments methods. That's it. Thanks for listening to me.